I'm here with Omer Dror, CEO and co-founder of Lynx MD, early stage company that we invested in about 9 months ago. And Omer, if you could just tell us in a couple of sentences what Lynx is all about pre-corona.
Yeah, of course. So actually, it hasn't changed much since Corona started. Normal days and in Corona days, hospitals generate tons of data, rich, unstructured data, images, patient medical records, vitals, all of that is very valuable, but it's locked inside data silos, inside healthcare organizations and between healthcare organizations. And in normal times, as well as in Corona times, this data really isn't accessible. 95% of the data sits inside silos that are completely inaccessible, not to the hospitals themselves and not to innovators, pharmaceutical companies, medtech companies, data scientists, especially around COVID-19. There are a lot of these types of groups that want to help develop new diagnostics, therapeutics, vaccines, do scientific research around the virus, but the data really isn't accessible to anyone. Lynx connects the data silos. What we do is take up all of this data in a very easy and fast onboarding process. We put it up in a dedicated cloud environment. We take care of the security and compliance of that data and make it accessible to hospital analysts and researchers, as well as external analysts and researchers and data scientists, so that they're better able to make decisions using the data and develop diagnostic solutions, therapeutic solutions, and do basic sciences.
Maybe you can share with us a little bit more in detail why Lynx's platform is really well positioned to deal with this kind of situation where we don't even have, a beginning or an end, knowing where to start with the data, where the data is. It's dispersed all over the world in little pieces, and why your platform and the architecture of your platform is really well suited to deal with such an unexpected situation and data influx, not just in the regular times where we have a lot of data in healthcare, but in a specific situation where we need insights now to get this pandemic under control.
So this is a really interesting situation because it was unexpected and because it's a completely new thing that nobody's ever seen before. We're developing the best practices as we go. And physicians inside medical centers that are seeing cases of Corona are thinking about what are the right diagnostics, especially with tests that are missing, and how to treat these cases. And the best practices are being developed as we go along, on the go. And the key here is to be able to share these insights and share the data that supports these decisions with the medical community. And that's a really challenging issue because you see a lot of these cases of emergency physicians sharing, we've treated this many COVID-19 patients, and this is what we've seen work, and this is what we've seen not work as well, and this is what you should do. Really, the data that supports these decisions isn't being shared. And if you want to do a deep dive into what people tried and what they haven't tried and what works and what doesn't, we need to do a better job at opening up these data sets.
You guys know how to do it fast. You're extremely scalable. You can get the data up and running and ready for exploration in almost real time. And I think, that is extremely valuable in any situation and just our day-to-day, low friction with the healthcare systems and generating immediate value for the healthcare systems on the one side, as well as to the healthcare innovators that need access to data on the other side. But why is it so important now, and maybe just give an example of, just to make it more concrete, how quick you can get things up and running for a healthcare organization to begin to explore those siloed data sets?
Yeah, so I think one of the greatest things about the way we've structured our platform is that it's schemaless. What that means is that we can set up an environment and upload or onboard new hospitals within 48 hours, actually having data in the system and starting to analyze it and seeing results and pulling out insights. So we don't have to work on the data, make sure that it conforms with this standard or another standard. We can just onboard it as it is from the hospital systems, do a quick pull and make it available to whoever the hospital wants. I think another key factor is that the medical center or the hospital administration, they control exactly who they share their data with in our model. And that allows making the data accessible to a lot of people, but on the same time, keeping control of it and making sure that it's compliant, and that if you don't want to share the data anymore, you can always take it off.
In early March, the first week of March, both of us were in the United States, different parts of the country, and speaking kind of pretty frequently. And this was before, like things really got out of control in the United States, and people really started to understand what was about to happen. People were still pretty blasé. I was in Boston. I think you were in the West Coast, and business as usual, really. And towards the end of my very short visit and your longer visit, I was saying, I think you should get organized to go back home to Israel, because we were starting to hear that more and more incoming passengers from different countries were being sent to self-isolation. And you said, well, no, I have to stay here. You were with your co-founder, Ophir. We have to stay here and, continue to work with our customers. And it's really important accounts. And, we have an account here and we have to go there. And I said, Omer, get on a plane and go back to your home country. Eventually, you came home earlier than you wanted, but still pretty late. And you were, as a result of that, sent into self-isolation for 2 weeks. And which made you basically, I think you said to me, you didn't see your wife and your very young kids for 5 weeks physically. Like it was all like FaceTimes and videos, and you were getting food delivered to your door.
Very productive 2 weeks in isolation.
Very productive 2 weeks. Yeah, and a huge sacrifice, right? So, I mean, and I really thought about it a lot during those several weeks, because it shows how much an entrepreneur is really committed to their other baby, and I know it was a huge sacrifice, and you could have taken a different decision and come home earlier, and maybe you wouldn't have been able to make that next step forward with those customers and prepare them for the go lives, etc. And it would have been a different price to pay. But you stuck with it, and I mean, I personally really appreciate it, and I'm sure your wife maybe a little bit less, but it's not taken for granted. Lynx is not your first startup. You were a co-founder of another startup in a different industry, in the tech domain. So you know what it's like to have ups and downs in a startup company. Some are often related to the company itself, and some are macro issues, such as the one we're facing right now, which is really cutting across every industry, every domain. Anything in your previous experience that kind of better prepared you to take on this crazy challenge?
Yeah, so funny thing is, I spent about 6 years in the Israeli intelligence, and this very much feels like an operation, like an army operation. Everybody's trying to pull in all of the forces, all of the talent, be creative, find new ways and new solutions in a very short period of time, try to do what they can. Also, I think as an entrepreneur, you see a lot of ups and downs. Some are steeper than others. I think you always have to expect the best, but prepare for the worst. And it's really important to make sure that you have a good enough runway, that you're doing the right thing, to approach customers, to see how you can help and work together with your clients and partners. And I don't think that changes. I think healthcare is the right industry to be in at this point. Other industries are going to get hit much worse.
Yeah, and to continue to be creative and innovative with the way we think about the business and the business models and the go-to-market and how we serve our customers, and do everything that we need on top of making sure we have enough runway to really get over this hurdle and be on the best side of it when it's behind us, and it will be behind us. I'm sure of that. Elbow bump.
Elbow bump.
All right, thanks, Omer.